Welcome to Insight Research Podcast, where we explore the journeys and motivations of clinical academics, researchers, and healthcare professionals shaping the future of healthcare and science. My name is JoJo Chukwuemeke, known as JoJo. I'm a student nurse studying children nursing from Kingston University. And today's episode, we are diving into the exciting world of clinical research. What does it mean to be clinical academic or clinical researcher? How do they bridge the gap between research and practice? And what inspires them to take on this unique role? Today with me in the studio to talk about this insightful topic is...
Hi, my name is Queen Adeyanju. I'm a ward sister on private care at Royal National Orthopedic Hospital. Currently, I'm a nursing research fellow, and I have a funded place for the pre-doctoral with King's College London.
And my name's Dr. Ian Simsock. I'm a diagnostic radiographer by training and a clinical academic radiographer at the moment, and work at Great Ormond Street Hospital for Children in London, in the UK.
Thank you, Queen and Ian, for gracing us today with your presence. For our listeners who might be new to this, how would you define a clinical academic or clinical researcher? When I first heard the term, I thought that a clinical academic would be someone who is into academics, like a lecturer, and not on the ward, not practicing. But that view really changed when I researched into it. So, if you can summarize the definition, it would be useful. Queen, can you tell us what a clinical academic or researcher is?
I would define a clinical academic as somebody who does practice with clinical work on the ward, meaning that you still have your clinical hours, and then you still do a little bit of practice with your messed that up. It's practice with research. Clinical academic is practice with research. And having practice with research is all your clinical aspect of it. You still have some clinical hours, and then you still do a bit of research. The research that you do is just to promote patient safety, to practice evidence-based, which will continually help the patient, and we as the healthcare service person to do the right by our patient, keeping them safe at all times.
Yeah, I agree with Quinn, certainly. I think it's about having that clinical experience and using that clinical experience to spot maybe areas that you can improve through some research, and to find and identify that research projects, and then to use your academic skills to make sure that you research into it in a suitable manner with good clinical practice, that you attract funding to be able to complete that research and to lead that research independently, and to build your own team, and eventually to have that impact on patients, to make sure that your work that you've looked into solves a clinical problem and improves it, sort of life within the practice for patients and their families.
Wow. Does that mean that you do extra hours? Because you said you still have your clinical hours. Then as a researcher, you still have more hours. Does that mean that you put in more hours than others?
I think there's always, with research, there's always the pressure that you never quite finish everything you want to do. And I'm very fortunate, and I've worked very hard to have a permanent clinical academic role at Great Ormond Street, one of the first in the country for a radiographer. But that means that I have clearly defined days where I do my clinical practice and days where I do my research practice. And that academic sort of research part of it sometimes spills over into doing stuff in the evening or doing stuff at the weekends. But I think that it's just about making sure that I feel I'm prepared as I can be to make sure I do the best work possible. So there is a little bit of extra work to do, but I think that it means that I feel better prepared. I feel that I'm doing the work properly and making sure I can, and also then I can attract funding and complete it with the right funding and things to do it. So there's a little bit of pressure sometimes to do extra work, isn't it, Quinn?
Yeah, I agree with that because there's always, like he said, there's always that time you will need to put an extra work in. For my nursing research fellow study, I had to do most of my recruitment during my own personal hours. At times I have to work Monday to Sunday to recruit the patient to make sure that do the study the way it's supposed to be. But luckily enough, my department did support me with 15 hours per week to have this done. But the fact is that those hours are not enough. So I need to put in a little bit of extra hours on my part. But the good thing about it is that the more you do it, the more you find the result. You have that satisfaction of what you're doing. And even though you put in that extra hours, it's not as if you're forcing yourself to do it because you enjoy what you're doing.
I definitely agree with that. I think the more you put in, sometimes the more you get out as well. And things that I did extra work 5 years ago are really paying off now with opportunities to work with people, to get extra funding, to become that expert in that field. So it's never wasted, and also it can be difficult at times, but it doesn't feel like I'm doing extra shifts for no money. I'm doing it for the reasons that I want to do it, and also that it gives back more to the funding that we've got and to the patients. So there's a reason why I do it, definitely.
Lovely. What I got from that is there's a lot of passion involved. That's good. Next question. What does a typical day look like for someone in this role?
I think that's what the beauty and the thing that really attracts it to me. I've worked in radiography now for nearly 30 years, and what's beautiful about my clinical academic role is that there's almost never a day that's the same. It's always changed. So I might be doing clinical work, and that obviously takes a bit more of a set sort of procedure. But when I do my academic work, I might be writing a paper first thing. I might be collaborating and having meetings with other people outside of radiography or within to plan grants, to plan research trials. I might be developing presentations. I might be coming to a radio studio like this. It's really wide and varied. I might be running patient and public engagement events where I'm talking to people who I'm affecting, and that to me is the real bonus of it, that my week to week, from day to day is really varied, and there's never a dull moment. Certainly it's always challenging but always really interesting. That's the beauty of it, I think.
Oh, that's so inspiring.
I agree with that as well, because in research there's always something new. There's always something like people giving webinar or something that you've not heard before. I remember when I started the study on virtual reality, even though we use it for cinematography at home, bringing it to the hospital, people were just like, can you actually use this in hospital? And patients were quite engaged with it. I wanted just 20 patients for it, we over recruit for it because people are quite interested in it. And then the more you do it, the more you feel like there's always something else, something extra that you can do to make things better.
Wow. So I have a particular question for you, Queen. So as a ward sister, can you tell us the difference between clinical work and research work?
Your clinical work is what you do on the ward to make sure you take care of your patient from admission to discharge, even discharge into the community, make sure they are safe to go home, maybe involving the other MDT, like the OTs, the physios, to make sure the patients are safely discharged home. And the research work is just doing a bit of research to make sure what are the gaps we have on the ward, how can we fill it to make sure that the patients are safe. Everything we do on the ward for the patient is about patient safety, make sure that they go home safely, and make sure that they understand their disease progression to the way that they can be at the best new maximum for them. So in order to make sure those things work hand in hand, you would do your bit when you're on the ward, and when you are doing your clinical research, the gap that you have, you research. It might not directly be you doing the research. You might give it out. You just say, there's a gap here. I need to research into it, and somebody will have research into it, and then we'll bring it back onto the ward to see whether it works or not.
Oh, thank you for that insightful information. So on to Dr. Ian. So you mentioned, Queen did mention that during one of her research, they brought in like her equipment to see how the patients will respond to that. Can you tell me, how did those clinical research roles contribute to improving patient care or advancing healthcare practices?
Sure. So, my sort of skills as a clinical radiographer is in getting the optimal imaging from various different patients and using different techniques. And so for my PhD, I looked at pregnancy loss and identifying the causes of miscarriage. And to do that, normally you would have a conventional autopsy of the baby, but that can be quite invasive, or is quite invasive. So often parents feel that they don't want to have that done. So and they won't consent to an autopsy. So we started to create non-invasive imaging autopsies, and that's been around for quite a while now, using lots of techniques. But all of those techniques, MRI, CT, X-rays, ultrasound, all worked best with babies over 24 weeks. And there wasn't any technique that under 24 weeks, there's very small babies that we could do an imaging technique to try and find out the cause. So for my PhD, our team and myself developed micro-CT, which is a high resolution down to micron resolution, so down to thousandths of a millimetre. We can look inside the body doing CT scans to try and find out if there are any abnormalities with the formation of the organs and any of those that may have caused the baby to have died before obviously full-term pregnancy. So we used a new technique that's been around for a long time, but we used it in a new way, in an innovative way, to allow this so that parents can have a micro-CT. And we're the only place in the country that offers this as a clinical service, and in fact the only place in the world that offers this as a clinical service at the moment. And we've been able to do this for over 1,200 patients so far over the last 5 years. And that's been really good. That's definitely shown that parents now have greater choice in investigating their loss and in a way that they find is more acceptable to them, so they consent more easily and therefore can gain a degree of closure. We can't always answer the questions, but we can at least give them an option to investigate in a way they find acceptable and hopefully find an answer. And if not, go away knowing that they did their best, or they did something that was applicable and practical for them to do. So I think that's really where research is a good example that this technique didn't exist before. We looked into it, we did some studies to show that it works, and then now it becomes a clinical service. And I think that's what we all strive for, is to get something from an idea, prove that it is good, and therefore put it into clinical practice so patients can benefit and parents can benefit.
That's so impactful.
Thank you.
With that,
It's
because
really
it's not invasive, a lot of parents will more likely to consent to have the imaging rather than opening up and the opened biopsy.
Yeah,
I think it's a good innovation.
yeah, and we get lots of parents now who consent to it, and therefore obviously we can build that service. And then our next sort of step is to hopefully widen this out, to other hospitals, to other paediatric centres, so that then they can also do this micro-CT technique and therefore offer more parents on a wider scale the option to choose this. So we want to go sort of nationwide and international as well, to make sure that they too can have this option.
Wow, that is quite a lot. Thank you for making so much impact.
Thank you very much.
So can you share, now we're going on to passion, early inspiration, I would say. Can you share what first sparked your interest in clinical research? Was there a moment or experience that led you to this research career?
Yeah, I think right at the beginning of my student life, I was interested in the imaging side of things, and then towards the end of my third year I did my dissertation, my research project, and I really enjoyed that. I definitely put a lot of hours into that and got a lot back from it, in the feeling that I knew the answers before other people and could sort of tell people about it and explain about it. But I know that when I started then as a radiographer, there wasn't really much opportunity to do research in those days as a new clinical radiographer, and I got lots of experience. But slowly during my career, there were other opportunities to get involved in research, and I always took that opportunity. When there was a new scan happening, when there was a new technique, I sort of put my hand up and say, I'd like to have a go at this really, and to help out. And that's where that passion came from, that I then, as I did a few more research trials and got involved in small ways, I could see that it was making a difference. And I just like that opportunity to feel like you were at the cutting edge, to be able to make things better was quite a powerful, passionate tool to get up and go into work in the morning. And that's what really drove me forward to get involved. And it was a long road, but I think it's one that's worth taking. So I think it's just that impact and seeing something change was what drove me to become really involved in research.
What about you, Queen?
Yeah, I think my passion was sparked. I think it started from observation. I think as a student nurse, I came into nursing quite late in life, and as a student nurse, in an orthopedic setting, when the patient's family and friends are with them, they're happy having conversation, having cups of tea, nobody asks for pain relief. But almost immediately the family members leaves. They're like, oh, my pain is a 10 out of 10. I'm like, okay, but all this while, 2-3 hours, even before we've not given you anything, you were fine, laughing and talking. So I thought, okay, there must be something. Is it the distractive aspect of it that is causing them to do that? So over time, I keep doing the evidence-based research, reading stuff about pain relief and also. Then I came about virtual reality and I thought, this could be a good thing that we could use in orthopedic setting to see if it would distract them from the pain. So I started finding what is research like in RONH. And luckily I got involved with Jo. And she was like, yeah, that's a good research. Let's see what we can do about it. And that's how I started. And over time, I realized, even with virtual reality, that patients forget about their pain. And they ask them, what's your pain out of 10? Just say, I was in another ward. I don't feel any pain at all. But immediately after they stop the virtual reality, it's like, I think the pain is coming back. So where I'm at now is that if we prolong the virtual reality, is it going to help them? And with that, I keep on looking at how we can reduce the use of opioids in hospitals, because I know it's becoming a problem now, people going home with it. If we can do the distractive aspect of it, will it help reduce the amount of opiates that are used in hospital? Will patient be okay not to use anything but any other distractive mechanism that is available to reduce their pain? So, and then I think the love of reading and making my patients safe and comfortable is part of it.
Oh, wow. So for our listeners out there, you can develop your love for research in school or in your clinical practice. It's not too late to start. So I have a question here, but I think you've already answered that when you say, the question says, do you always envision blending clinical practice and research, or was it a path you discovered along the way? So you discovered yours along the way. I think yours came in like...
Yeah, I think though that the key point is now that there are loads of opportunities out there to develop your research career and your clinical academic career, and I think that's something that just didn't exist previously. Many years ago. So there's opportunities to get funding from the NIHR or from the Society and College of Radiographers or from the nursing colleges is out there now to be able to get involved in research and to do your own research right from when you're a student all the way through your career. And that's what I think changed for me sort of about 8 or so years ago, was I got an opportunity to apply for my own funding, to do a PhD and to lead my own research. And I think that up until that stage, I thought that I was plateauing, really. I was involved in research and I was gaining lots of experience, but the opportunity to then lead your own research trial, I think, is a real bonus and a real step. It's a tricky step, but actually when you've got those advocates and those supportive people around you to say you can do this and we'll be there along the way. I had a great radiologist who I still work with now, Professor Owen Arthurs. I had a fantastic lead radiographer, Claire Simsock, who made sure that I had the support in place in my clinical practice so that I could drive that forward, that I think I just never envisaged when I was interested in research as a student that I could ever get to this place. So I think it's about taking those opportunities, pushing yourself and seeing that you can get there, really.
That you have all around you.
Definitely, that support is so key, isn't it?
Because in nursing now, before nurses, we don't do research. But now there's funding there for nurses to really go for research. You are the one with the patient. You are the one that spend most of the time with the patient. You understand the patient. Why not do the research of what the gaps you find on the ward and make sure their patients are well looked after? So the HEE and NIHR, like you mentioned, are really giving nurses funding, but nurses are still not taking it up. We still have a long way to go.
I think that's really key, is that the individuals who work in a specific area, whether you're a nurse, a radiographer, physio, OT, those are the people who spot those clinical problems that need solving and have the skills to sort of know how to do that. And then you just need to get those academic skills to learn how to run the research trials. But the opportunities that Quinn would spot in a clinical practice are completely different to the ones that I would spot. But that means that we all need to almost step up to the plate and put ourselves to apply for that funding and to take on those opportunities. As scary as they are, you can do it and you can get there. And we, like Quinn said about the nurses, radiographers really need to step up and apply for that funding, because if we don't, other professions will. So we need to make sure that we show our patients that they get that opportunity by us taking it. Yeah, definitely.
And because healthcare is not an isolated profession, if I find something on the ward, you find something in your department, I do my own little research, you do your own little research. We meet halfway to say, okay, if my patients from the ward are going to radiography department, what can we do to make this better? And in that way, all the healthcare professionals, we can encompass what our patient needs in a nutshell that will actually bring out more impact than just even doing it individually. Because if you do your joint reconstruction surgery now, you still need your imaging to make sure that it's in the right place. What are the things we need to put in place from the ward to imaging to coming back that will make the patient's life more easy? So we can all work hand in hand, but each and every one of us needs to develop ourselves first. Nurses, radiographer, I think the physiotherapists are doing quite great with research, but every one of us needs to step up to the plate and make things better.
And those collaborations are really important, because we all have our own skills in our clinical practice and our own skills in the academic practice, but working together, we have a great collaborative team at Great Ormond Street called the Orchid Association, and the team there, and basically that's nurses, physios, radiographers, but we all come together and bring our own skills so that we can share experiences, build on those skills, and then work together. And it's not about working in silos, it's working collaborative. You often see when the journal paper comes out, it's got lots of authors, and they often spread over a whole different teams, and that's the real key. So those collaborations that you make can really build towards your career as well.
What are some challenges you faced in this field, and how did you overcome them? So as a child nurse, I believe that we already have a lot going on the ward, and the things we have to do as a nurse. We have so much medication, taking care of patients. So it's really it's really good to see someone go into research. So what are the challenges you faced, and how did you overcome them, Queen?
Yeah, one of the top challenge is the time. So on the days I'm working on the ward, there's no chance for me to do anything outside for research. That means my days off are the days that have to come to do my research work. Yes, I have the 15 hours, like I said earlier on, but it's just not enough. And my fellow nurses, because of the task, now the work they need to do on the ward, they won't want to come on their days off to come and do any sort of research. You want your days off to be your days off. And then secondly, because like me, I have my own family. You still have to think about your family time, because that's you need to have that work balance aspect of life. If so, you just have to be super organized. That's what helped me super organized that on this day, I do that. On those days, I do that. Every 30 minutes, 5 minutes that I have, if I need to jot something down, I jot it down straight away. I don't postpone, I don't procrastinate about it. And luckily enough, my family are quite supportive. So if I tell them I need 1 hour without any disturbance, they give me that. And when I come, rather than staying at home at times to do some of my research work, I just come into work, coming as if I'm coming to work and get it done. It's faster that way with no distraction.
What about you, Desmond?
I think I completely agree with Quinn there. I think I had 3 main challenges. I think the first one was time to do things, which is the same as you, Quinn. And I managed to get that by being seconded for a couple of years by the NIHR to work up my own grant and to work within my area so I could develop my own funding and therefore get to do my PhD full time. I think support, I've already said that I had 2 fantastic advocates for it to really push myself, Professor Owen Arthurs, the radiologist, and my lead radiographer, Claire Simsock, who really allowed me clinically and supported me professionally and personally to push myself and to go into that space. And then I think there's also always a challenge about sort of imposter syndrome and should I be here? Surely there must be somebody who's better qualified, better skilled, more knowledgeable, more expert in the area. And actually I think sometimes we just have to push ourselves in that space and to push yourselves to do something before you're ready, to make sure that you can do it. And that only comes from that support. And I think finally that the challenge that still is challenging really is rejection from grants. I still get turned down from grants.
Oh yeah.
But it makes me, there's a couple of days where you're like, oh,
that's true.
blimey neck, that's a shame that I've failed there. Yeah. But it makes me take on that criticism and say, right, I'm going to improve that then. You say that I didn't quite hit the mark for those reasons. I'll challenge that now and I'll make that better. Or I might get a journal paper rejected from a journal and I think, okay, I'll take that on board and that's important and then submit it to somewhere that is perhaps more appropriate or where it needs its home to be. So it's about that stickability really, that even when you take those knocks through challenges of no funding or rejection, actually you get back up again and you go again. And that comes from that support and that comes from that sort of that refusal to lie down really, that all clinical academics feel, all people who apply for these things do.
That's very true. That what you said, I totally agree with everything. With support for myself, Joe Texera is absolutely brilliant when it comes to support. I remember when it was in my first 2 grant that I applied for, both were rejected. I felt like, oh my, this is off. I'm not. Just no, don't worry about it. These things happen. It's part of being a clinical academic. They say no, you go again. You just make sure you put everything on board and you reapply again. So it's if you have that support, especially somebody that has gone through it before, that can say don't worry. That person might have had maybe all the fundings accepted, but it's not the end of the world. If this one doesn't accept it, we go to this one and you just carry on. You need that support to keep you going, and more so your own way of that. This is what I want. You keep your focus on what you want to achieve, and you go on.
Wow, the amount of support you guys received is reassuring, and it makes the pathway look more tasty now. So, how familiar are you with other clinical academic roles outside your area of expertise?
Yeah, I think working outside your own silo, which can be very easy in healthcare professions, to stay within the radiography, to stay within nursing, but making those collaborations and connections has been really powerful in my career. And things that I did 5 years ago by talking to a physio or talking to a nurse or a medic now has come to real fruition, either with future grants. I've worked with veterinary surgeons who now I'm on their grants, and we work with the Royal Veterinary College, and those things would never have happened unless I'd met those people all those years ago. We'd done some brief work together, and now it carries on. So I think it's about making sure that you get out there and network. And it's not easy, is it, to network when we you maybe go to a conference, or you go to have some people come to lecture with you. Sometimes it's about those conversations afterwards that you have, where you go up to them and say, hi, this is where I work. I found that really interesting what you talked about. Can you tell me a bit more about it? And those sort of things then sometimes come to fruition. At a conference, go up and speak to the speakers, or go around the posters and speak to the authors on them.
So for those of us considering a career as a clinical academic or researcher, what steps should we take? Are there any specific qualifications, skills, or experiences we should focus on?
I think just to have a general interest and inquiring mind about why people do things. When you're a student and you go onto new wards or new situations in your career, often you'll be told this is how we do it, and this is how we manage this kind of patient, or this is how we manage this kind of technique. And it's not about saying, oh, that's the wrong way of doing it, but just asking those questions. And as a student, that's the perfect time to say, oh, that's really interesting. Why do we do that? Or how do we do that? Or what's the reasoning behind that? And you'll often come up with very good reasons, and the staff there will say that this is the real reason why. And that's good for education. But also sometimes you might find something that would work for a student project. And I think it's about getting lots of experience. For my first few years of my career, worked in lots of different areas. It got the idea of where I wanted to be passionate about, but also I got so much clinical experience that I then could use in my career. So I just say yes to things. That's the real beauty of it, is to go out there, speak to people, and if there's an opportunity, grasp it with both hands, because it really does pay off later in your career, and sometimes quite immediately by getting involved and giving you that different viewpoint. So just go for it, really. I think is my key point. But
What about you, Queen?
For me, I think with my own pathway of getting into research, I came here as a newly qualified, and I saw that they had a research department. I became a research champion, whereby I attended all the meetings of research champions. They do different sorts, It could be anything pertaining to research. We talk about it. We do journal clubs. I joined that as well. We have dream meetings. I joined that as well. It's online. After COVID, we all went online. And I find it very interesting, because there you analyze papers, you criticize papers. We can do might be some lecturing. And from there, I went into, like I said, the virtual reality thing, and the support I had to do PEP form, do ethics. Ethics was approved. It's hectic, but I get approved. And I did, the proposal, and from there, here I am today, having the pre-doctoral in the funded place in King's College. So if the trust that you are working with, if they have a research department, join them, see what is available, and then, like he said, say yes to things. They want somebody to be research champion. Okay, I'll volunteer, I will do that. What maybe you need to attend a program for, I will attend if you give me the protected time. So from there, you know what you want, how you want your pathway to be. And then things like NIHR, they are quite good. They have some pathway, I think I've seen a couple of pathway framework that you can look at. How do I want my pathway to be like? And people are always happy to support. Just an email, phone calls, people are happy to support.
Oh wow! So we don't need like another degree. We can come in with our like when I graduate, I can come in with my professional qualifications,
yes, you can.
Transferable skills, and open-mindedness as well.
Yes.
Yeah, I think just coming in with that interest.
Yeah,
that's
interest.
The main thing. That inquiring mind, that interest to learn and to see new things. That's almost a qualification in itself, really.
Yeah.
Think of it like that. You're picking up skills along the way without formally doing it.
Yeah, there was we did nursing conference here, I think 2 or 3 years ago. There was an healthcare assistant that did a research project on the teddy bears that were used on outpatients. Surprisingly, that was the only paper that was presented that had standing ovation. She was an healthcare assistant. So, but qualifications, I think, is the interest that really matters. with the support that is available, you can get to where you need to get to.
You learn so much in your first year of clinical practice. All those skills that you've learnt in your university come into practice, and then you take those on and advance them. But it's about also at the same time keeping in touch with those academic skills that you learnt as a student and reading that paper. You know, if you can still get hold of the journals, go and find out why you treat that kind of patient the way you do, or look into it. And it just keeps your mind ticking over about how to read papers, how to assess them. You come up with ideas and how you might solve them. But just asking people and just get involved. That would be my...
That is it. Just get involved. Do not say, oh, I don't understand it. You learn as you go along. So from 2, 3 online, you go from there, you all learn together. It's not as if I know more than everyone. You learn, you discuss it. This is what is in the paper. What do you think? What do I think? And then you go from there. And I think NIHR, is it NIHR or RCN? They are happy to set it up with you. I think there are people that are happy to set up journal clubs with you. I think it's RCN.
Wow, this has been insightful, informative, and very interesting. I'm glad that you guys were able to join us today. Well, before we wrap up, is there anything else you'd like to share with our audience about the career or your experiences?
Yeah, like we have discussed earlier on, the main thing is just if you have the passion, go for it. Don't let because somebody say you can't do it, it means, okay, I have to give up. Go for it. You have the passion. You have the vision. Go for it. Don't let nothing stop you.
You guys have given us so much information that we can use that to follow up what we want to do. Anyway, it's been wonderful minutes. In our future episode, please, our listeners, you have to join us for our future episode. We will talk about research nurses and practitioners, understanding their roles inside delivery research team. I think that is one interesting topic because we just, brushed through the surface of what clinical research is. Dr. Ian gave us an insight of one of the research that had to do with the women and the babies as well. Anyway, we are going to go in depth into that in our next podcast, and we will love everyone who was here today to participate. Thank you for listening to the Inside South London Research Podcast. Don't forget to subscribe and stay tuned for more inspiring stories. Don't forget, I'm your host, JoJo, and Queen, and Dr. Ian. Hopefully, one of these days, we would love to have you back into our studio. Thank you very much.
Thank you.
Thank you so much.